Today, we're looking at OMG Medical Moments. If there's one thing that you never want to hear a medical professional say, it's, "Oh my God." Today, we've got stories of bizarre discoveries and wild emergencies from across the internet, all leading up to one about a doctor dealing with a neglected child and an awful parent that's so devastating, it's impossible to forget. Currently, I work as a nursing assistant, and this is without a doubt the oddest thing I have ever experienced. You see, we had a woman in charge of payroll who survived a shooting in a past marriage. The bullet hit her in the back of the head. However, surgeons decided that it'd be too dangerous to remove the bullet. Surprisingly, it didn't inflict any significant harm on her brain, and she continued to lead a normal life provided it healed the right way. One day, I went into her office to collect my salary slip. We were making small talk when, out of nowhere, she started coughing in fits and starts. In an attempt to soothe her, I patted her back. And guess what happened next? She suddenly coughed up the bullet into her hand. We ended up calling a doctor who had treated her before. He explained that it was possible that over the years, the bullet had gradually worked its way out. After this unusual event, she was absolutely okay, and she ended up holding onto the bullet as a keepsake. People in the medical profession are just built different. The chances of this have to be seriously rare. If I'd witnessed this myself, I definitely would have screamed. I used to work as a nurse in a remote hospital with patients who, it seemed, did everything in their power to avoid visiting us, even when they clearly needed to. My favorite character was an old farmer. He paid us a visit complaining about persistent chest pain. When I asked if he'd experienced it earlier, he confessed he'd been feeling such pain sporadically for a few years. But he had a bizarre way of treating it. He said that usually the pain subsided after he touched his electric fence. It all began on one occasion when he was near his farm's electric fence and he experienced the chest pain. He unintentionally grabbed the fence to keep his balance, got shocked, and noticed the pain was gone. Since then, anytime his chest pain attacked, he would touch the fence to alleviate his discomfort. It had kind of given him the same effect that a defibrillator would. Incredibly, he had been treating his own intermittent heart rhythm this way for years. You've gotta admire how stoic this old guy is. Even if he didn't mean to, he found a way to deal with the problem without going to a doctor. With that said, I think the fact that a shock from an electric fence did more good than harm would have been my first sign to head straight to the emergency room. One day, I spotted an odd little bump on the center of my tongue. I brushed it off, figuring I'd burnt it on hot food or something. But by the next morning, the little bump had ballooned. It took on a really creepy appearance, which had me running to my mom for help. She was in quite a panic herself and rushed me to the doctor without a second thought. We spent what felt like an eternity in the emergency room. My mom was near tears and restlessly pestering the nurse on duty. Finally, our painstaking wait was over as they called my name. We were led into a room where our medical adventure escalated. You see, after inspecting my tongue, the doctor admitted he'd never seen anything like it before. My mom broke down, and I felt my heart racing. We were used to trusting in doctors implicitly being part of a medical community. Soon, more medical experts were called in for their opinion. They next transferred me to some sort of dental chair and proceeded to shine unforgiving bright lights onto my face. In no time at all, 5 doctors and even the head of the hospital were gathered around, gaping at my tongue. My mom was petrified in a corner, watching in mute terror. The expert minds finally concluded that the only feasible method to get to the root of my issue was to poke the bump. Imagining what was to come, I wished I could ask for a second opinion. Since they had a firm grip on my tongue, verbal communication was out of the question. They numbed my mouth with an odd mustard-flavored anesthetic. The leading surgeon gloved up, masked up, and had his goggles on, ready for action. Slowly, he brought a shiny metal instrument close to my mouth and applied some pressure. As he retreated, he looked at me, and out of the blue, he asked when I last had popcorn. Caught off guard, I mumbled something about eating popcorn a few days back while watching The X-Files. That's when the mystery was unraveled. A perfect half of a popcorn husk was presented to me on my bib. Apparently, it had stuck onto my tongue and had been rapidly covered by new tongue cells. The room filled with amused laughter. My mom's tears of worry were replaced with tears of relief, and I was left utterly flabbergasted. It even landed me a spot in a reputable medical journal. When you're a kid, you kind of feel invincible, but when something happens to freak you out and your mom freaks out too, that's when the fear really sets in. Now, can you imagine going through that panic and terror only to have it be part of a husk of popcorn? I think I'd be too embarrassed to laugh. My dad is a doctor, and he shared this one particular story from when we lived in Scotland in the early 1990s. This was one of those rare sunny days that the locals might actually get a tan. Because let's face it, tanning doesn't usually go hand in hand with the typical climate there. One overly ambitious man, however, decided to seize this sunny day. He pulled out his stash of aluminum foil sheets, slathered himself in cooking oil, and tried to get as much sun as possible. But as it turned out, this was the biggest blunder he could have made. His poor skin just wasn't used to getting that much sun, let alone with the foil and cooking oil to help it along. Just as you'd expect, he showed up at the emergency department a few hours later, covered from head to toe in painful third-degree burns. I can basically feel the burn through the screen in this one. There are few things more painful than a bad sunburn, and I can only imagine that it feels worse knowing you set yourself up for disaster. The foil, the cooking oil, it could have all been avoided. During my time as a medical student, I collected a few unusual stories. This one, while not necessarily gross, definitely feels like it was straight out of an episode of The Twilight Zone. I was doing a workup on a patient for a particular problem, and I suggested an MRI. Her calm response was nothing short of shocking. She told me she wouldn't be able to have an MRI because she had a metallic tracking device inside her body, implanted a decade ago when she was, according to her, abducted by extraterrestrials. Just before this, we had spent an hour in conversation, and she had behaved absolutely normally, showing no signs of any mental instability. Composing myself, I smoothly suggested that a CT scan could be a safe alternative for her. I'm rarely surprised, but that one got me. How do you hide your shock when someone comes out of nowhere and tells you something like that? I think I wouldn't be able to hide how stunned I was. I wonder if they teach in class in medical school on how to keep a straight face in bizarre situations. A man came into the clinic one day claiming that he couldn't see. We asked him when this began, and he nonchalantly revealed it had been happening for the past 5 days. He hadn't rushed to the doctor or been that concerned at all. He thought his blindness might simply pass like a common cold or something. Now, while examining him, when I asked him to move his legs, he casually said, "Oh, I can't do that." And I was just flabbergasted. Further probing into how long he had been unable to walk, his wife joined the conversation saying, "Oh, about 2 years." They hadn't sought any medical help in all this time. Instead, they borrowed a wheelchair from a friend and carried on as best they could. With a few tests, I was able to tell what had happened to him. It turned out this man had suffered multiple strokes due to several unintended risk factors. Considering his lack of understanding about his own medical conditions, I genuinely felt sympathy for him. I can understand not wanting to see a doctor. It's expensive, it's time-consuming, and the news is rarely good. Sometimes it can be easy to convince yourself that ignoring the problem might make it go away, but this is truly next level. One of my best friends, a dedicated nurse, is always sharing the most intriguing stories. She's often stationed on the medical surgical unit at the hospital and once had an unusual female patient. The woman's various conditions required her to have assistance, but not from a dog. She had a service monkey. This service monkey was really quite useful, fetching her glasses, managing the TV remote, you name it. It was a bit peculiar, but nothing too out of the ordinary. Until one day, when things took an odd turn. That afternoon, my friend went in to check the woman's vital signs, as she'd done many times before. But this time, she unexpectedly found the monkey nursing on the woman. She just walked out of the room without saying a word. I have a few friends in the medical profession, and when I'm not bugging them for advice, I'm bugging them for wild stories. I've heard a lot of them, but I'm not sure I've ever heard one quite this insane. There is no way I'd be able to keep this to myself. I'd have to immediately call everyone I know and tell them. One night on my emergency room shift, a lady walked in citing a stuck foreign object. When I asked her about it, she explained that during an intimate moment, her partner noticed something had nipped off inside her. Though she could sense that something was indeed out of place, she wasn't able to fish it out. Along with a nurse, I got ready to investigate using a speculum and forceps. I was expecting to find a lot of things, but the one thing that did come out was completely unforeseen. It was a $20 bill. Bewildered, I asked her if she'd put it there, to which she answered no. She was clearly as puzzled as I was about the situation. I offered her the bill, which she refused, so I ended up throwing it away. I've never really understood why the woman had a $20 bill inside her, or why her partner would have left it there in the first place. Before I read that story, I thought there was never a situation where I'd throw away a $20 bill. But that was my life before. Now I know there is totally a situation where I'd throw away a $20 bill, and I wouldn't think twice about doing it. Recently, I had an eye-opening experience while on duty in the surgery department, where we performed surgery on a patient with a severe case of an inguinal hernia. Honestly, I thought I'd seen it all during my time at the hospital, but boy was I mistaken. This patient had some mental health challenges to boot, and once we had him sedated and prepped on the operating table, we removed his robe for the initial inspection. We proceeded with an open abdominal surgery, and what we found was seriously shocking. This consisted of an intense few hours of meticulously removing his intestines from his groin area. In a nutshell, the patient's abdominal wall had ruptured, causing his intestines to slowly sag into his groin over time, a situation that went unnoticed for several years. Sorry for the phrase, but this story is absolutely stomach-churning. There's nothing more complex or more disgusting than the human body. And I have to hand it to doctors and nurses because they really do see it all. I do not know how they do it. My father-in-law had worked in the emergency room for 2 decades. There was one incident that really shook him. It was a man who reported a stomachache. After an initial assessment, the doctor determined that he needed to perform a scope. As he was exploring the patient's bowels with a camera, abruptly, a light ensued from the opposite direction, obstructing his view. Shockingly, it was a flashlight. Though one could guess how it got there, it's baffling why it was switched on. The doctor could hardly contain his laughter. He excused himself, advising the patient he needed a second opinion, and burst into laughter outside, comparing the situation to a cartoon where someone runs into a tunnel only to have a head-on collision with a train. There are definitely a lot of surprises in the medical profession, but not like this. Coming face to face with a flashlight while deep in someone's body. Although I can't stop reading these stories, this one is making me really glad I never went to medical school. While on shift in the emergency room one night, we had a man come in complaining of discomfort in his groin area. After examination, it turned out he had placed a school locker-style master lock, the kind with a revolving dial, around his private parts. The lock was causing a blockage where blood could enter but couldn't exit, causing extreme swelling. Upon realizing he couldn't recall the combination to the lock, he had tried to force it open with a screwdriver. That's when true disaster struck. He ended up snapping off the dial. We asked the urology department for advice, and their first suggestion was to take the man to surgery. Their plan was blood-curdling. They wanted to make an incision lengthwise, remove the top and bottom parts of the lock before stitching him up again. As you might expect, the poor guy was not too keen on this idea. So the alternative suggestion was for one of our burly nurses, Tom, to use bolt cutters to break the lock off. They opted for this plan. Behind a closed curtain, Tom counted to 3. At the count of 3, there was a loud cry from the man and a popping sound. Tom emerged with the broken lock, and the man was then taken to a private room to recover from the ordeal. Hopefully, he learned a lesson. I'm not sure if bravery is the right word, but I seriously can't believe the bravery it took for this guy to admit that he wasn't getting out of that situation without a doctor and a walk to the ER. But now that I think about it, maybe the real brave one was Nurse Tom with the bolt cutters. One afternoon while I was working in the emergency room, an elderly woman was brought in from a nursing home. She seemed very troubled and kept calling out for help. It seemed she'd been brought in because of her agitation. Sadly, this often means the nursing home staff found her tough to manage. We assigned a care assistant to help soothe her and ensure she didn't wander off. The assistant was feeding her, and as I was walking by, the lady suddenly choked on her meal and fell backward. Immediately, I hit the emergency call button and the team sprang into action. We made sure her airway was clear, although she wasn't able to breathe on her own. A surprising fact, considering that there was no food stuck. With no heartbeat detected, a male nurse started chest compressions, and another nurse attempted to insert a breathing tube. But as soon as the chest compressions started, a shocking scene unfolded. A gush of thick, murky green substance came out of the woman's mouth. The nurse performing compressions had to carry on while his colleague continued attempting to clear the airway and insert the tube. It took about 5 to 6 minutes for the nurse to insert the breathing tube successfully, after having suctioned the unknown substance. Despite an attempt to revive her with a defibrillator, the doctor had to declare her dead. Later, we discovered the cause. The poor woman had a severe bowel obstruction. It seems her heart stopped while she was eating, and the gooey mess was due to the damage from the bowel obstruction. Needless to say, I took a very thorough shower that night. This one's a real-life house-style medical mystery, but this case is far more gross than anything that happened on House. Sadly, sometimes even when you find the cause of someone's problems, it doesn't always mean they're going to make it. My father is a doctor specializing in internal medicine. He once had a visit from a young man who was barely out of his teens, who came to the hospital with a concern about a personal issue. The poor fellow was experiencing intense itching and discomfort in his groin area. My dad, in order to diagnose the problem, asked him to lower his trousers. The young man was black, so imagine my dad's surprise when he noticed that the young man's hair down there was stark white. As it turns out, the itchiness was due to the young man contracting lice, or crabs, from a partner. These tiny creatures had laid their minuscule eggs in his hair, creating the illusion of it being white. Even now, the thought of this gives me the creeps. Wow, I did not see that one coming. That poor guy. Nobody wants to deal with that. Thank God there's no photo proof of these stories, because even without it, this story is going to appear in my nightmares for the rest of my life. My wife works as a surgeon, and each night she has about 60 minutes to share the distressing things she encounters. One story that particularly stands out involves a young couple on a motorcycle. They were navigating a tunnel that connected two highways. The boyfriend was driving at an alarming speed. As they drew nearer to the tunnel wall, the girlfriend riding on the back panicked and made a devastatingly poor choice. She decided to brace herself by placing her foot against the wall of the tunnel. Unfortunately, her foot snagged the wall, catapulting her off the bike. She tragically broke her leg at the thigh, the sharp end of the broken limb thrusting into her groin area. The surgical team had never seen anything like it. Unfortunately, I could picture this one in my head as I read it, and now I can't unsee it. That is some seriously gnarly stuff. There have been a few instances I've seen like this, but let me share the most memorable one. A woman visited us on Monday after being released from the hospital the previous Friday post-childbirth. Typically, we tell women to abstain from intimate activity until cleared by a doctor. However, her partner persisted, so she finally gave in on Friday night. Big mistake. This resulted in the tearing of some stitches, leading to severe bleeding all weekend. She arrived at our clinic pale-faced with bluish lips and fingertips. Her hemoglobin level was at a low of 4, when the average is around 12 to 15. Trying not to be a nuisance, she didn't seek help until she constantly felt faint. In the end, she had to return to the hospital for a blood transfusion and some necessary repairs, including a fresh set of stitches. This time around, the couple listened to our instructions, thankfully. Oh my God, this poor woman. What are these people thinking? I may not always listen to my doctor, but even I know that's a bad idea. A few guys had too much to drink and decided to drive around town. One of them, sitting in the passenger seat, was leaning way out the window to throw up when the car suddenly rounded a sharp bend and began to teeter. The rollover incident resulted in the top of the passenger's head scraping against the road, revealing his brain. But the story doesn't stop there. A friend of mine, an emergency medical technician, treated the guy, and it was a real ordeal. He had the grueling task of removing pebbles and other debris from the man's brain. The sobering part, the guy was still awake during this. Even though I wasn't present, every time I think of this incident, it sends shivers down my spine. This is like something straight out of a horror movie. I seriously can't imagine the nightmares I'd have if I saw something like this in real life. I've never heard a public service announcement against drinking and driving that scared me as much as this story did. My mom worked as a nurse in the ICU for a decade, so life was always interesting. On her initial day on the job, she was on a break when all of a sudden, a woman, her head swathed in a towel, strolled into the hospital. In a composed and quiet manner, the lady revealed that her spouse had lost his temper and hurled a hatchet at her head. Fortunately, her forehead, being the most robust part of her skull, bore the brunt of the injury. This allowed her enough strength to bandage her wound and drive herself to the hospital. Thankfully, the woman turned out fine for the most part, while her husband was eventually apprehended by the police. Talk about a surprise. I can't imagine the pandemonium that broke out when she pulled the towel down only to reveal a hatchet. It's incredible that this woman survived, let alone drove herself to the hospital. Back when I was training to be a paramedic, we'd often be stationed in the emergency department. One time, a man was brought in from what seemed like a really poor nursing home. At a glance, everything appeared normal until they removed his trousers. This is when we saw the problem. His junk was about the size of a football and showing signs of necrosis. This is a condition known as Fournier's gangrene. A reasonable guess would be that he'd had it for some time, considering the size, hue, and unsavory smell. He was a stroke survivor and now seemed significantly more confused than what was typical for him. The sight was disturbing, but the smell was the real kicker. One of the interns who came into the room to check on him almost threw up. I truly felt for the man. He seemed clueless about the situation, and he must have grown accustomed to the unusual odor. When I returned home that evening, my roommates and buddies had decided to prepare some snacks. One of them made mini crab cakes. Unfortunately, I immediately had to leave the room. The scent transported me right back to the scene with the man at the hospital. It was an irony that was quite hard for me to stomach. Okay, I take it back. This story is actually my worst nightmare. Like I said before, medical professionals are some of the bravest people out there. They see the most messed up stuff and then still manage to help the people who need it. As an ear, nose, and throat specialist, my primary focus is handling sinus diseases and ear infections these days. However, during my tough residency years, we often found ourselves responding to a lot of facial injury emergency calls. There was one day when we were asked to rush down to the emergency room for a self-inflicted facial wound. These cases are never easy, but this one was unlike anything I had experienced. A man had shot his face with a buckshot, essentially obliterating its structure. Despite the horrific situation, there was an incredibly brave EMT who managed to secure an oral airway while out in the field. Once he was with us, we switched out that airway for a breathing tube placed in the throat and did our best to suture the remaining tissue. A few days post-injury, we staged a 14-hour surgical operation, where we took segments from his abdomen and leg to reconstruct his face and jaw. In another operation, we created a functional mouth opening for him. However, without a tongue, eating remains quite the struggle. You could watch 1,000 medical dramas on TV and never come up with something as insane as this. This guy is lucky to be alive, let alone to have ended up with a medical team skilled enough to save his face and jaw. One day, a man arrived at my clinic complaining about a swollen finger. He explained how his finger had become inflamed and painful a week earlier, and it continued to worsen over time. 3 days before he came in, he noticed an open wound at the end of his swollen finger. On the day of his visit, the man casually mentioned that he had extracted something from this open wound with a pair of tweezers, but he wasn't exactly sure what it was. Intrigued, I asked him if he had taken a photo or kept what he pulled out. He responded by pulling out a tissue from his shirt pocket. What I saw left me awestruck. Unbelievably, it was his distal phalanx, the last bone in his finger. The bone had gotten infected. In response, his body tried to expel what it perceived as an unwelcome foreign body. So essentially, this man pulled the tip of his own finger out from his finger. it was like a baffling magic trick that I haven't seen the likes of since. You know that feeling you get when you hear nails on a chalkboard or a knife scraping a plate? That's the exact feeling I got when the writer of this story revealed that it was a finger bone. I may never recover. I had a young girl who must have been 6 or 7 come in with a swollen face and jaw. We realized that she's never gotten any dental care, so a bunch of her teeth were rotten and abscessed. That was bad enough, but when I talked to her mom and asked why she'd never been to the dentist, her answer was infuriating. She said that whenever the little girl complained about her teeth, they assumed she was simply pretending to be sick to avoid going to school. See, if I were in this situation, I would have let the mother know what I really thought of her. There's just no excuse for neglecting your child like that. It's a sad story, and I can only hope that little girl is taken care of properly. That's all the medical mayhem we have for today, but stick around and check out the other videos on our channel for more wild stories about the human experience.